Thank you for joining us for this second video. Next, we will be talking about beverage changes prior to bariatric surgery. Our next goal is to drink at least 8 cups of water daily, which is approximately 64 ounces of fluids. The kicker here is we do want you to sip that throughout the day. And that is because after surgery, if you take a big chug or glug of water, that can fill up your really small stomach pouch quite fast. And that just does not tend to settle well and actually can cause vomiting. Another big reason for this is obviously we just want to keep you hydrated. Especially after surgery, you'll have higher fluid needs to heal from the bariatric surgery, and then lifelong, 8 cups is kind of the minimum to keep you hydrated. We'll also ask that you avoid high-calorie beverages such as juice, sports drinks, energy drinks, coffee drinks, soda, and alcoholic drinks. Water really is the best hydrator, but you can use other flavoring products to add a little bit of, again, flavor or appeal to your beverages. So that could be things like your sugar-free options, such as Crystal Light or Mio's. You can also do fruit-infused waters, whether you make your own at home or use options such as hint water. You also can do decaf tea and coffee, as long as we're not adding a ton of sugar or cream or honey or those types of flavorings. The main reason we do want to avoid these high calorie or high sugar beverages is to make sure that we are really filling up our bodies with nutrient dense foods, meaning foods and beverages that we can derive or take nutrients from. Oftentimes these fluids, we call them empty calories. So they're not really providing us much nutrition, but unfortunately they are providing us with a lot of calories, which can lead to excess weight gain. Another thing, and we will be talking more about this in a couple slides here, is we want to prevent dumping syndrome. Foods and beverages that are high in sugar and fat can cause dumping syndrome. Dumping syndrome typically is when food or fluids flush through your digestive system at a very rapid pace and can cause things like diarrhea, a very faint or dizzy feeling, and it really depends on the person what symptoms you do get from dumping syndrome. But unfortunately, this is something that does come along with bariatric surgery. This is most common with the bypass surgery, less common to feel the dumping syndrome with the sleeve gastrectomy. But just because we can't feel it doesn't mean that it's not happening, maybe just at a slower pace in our body. Next, we do ask that you avoid carbonated beverages. Unfortunately, even small amounts of carbonation after surgery can pose an issue. So this is something we would want you to totally eliminate. The main reason for this is carbonation has a small reaction in the stomach where it's almost kind of like a small explosion. If you've ever seen someone put Mentos in a pop bottle and you saw how the pop just exploded out of that bottle, it is a similar but smaller reaction to that. Salt actually has the same effect as that Mento or that mint would have in that pop bottle. And our stomach always has some concentration of salt or sodium. So we get that fizzing and that small reaction in our stomach with each sip of carbonation, even before surgery. The issue is after surgery, our stomach is a lot more rigid. So if our stomach expands from that reaction after surgery, it has a really hard time going back in. So in a way, carbonation really can reverse the bariatric surgery because it can stretch out your stomach pouch. And that can lead to even larger issues. If your stomach pouch is stretching out, we're at higher risk for things such as stomach ulcers and gastritis. Next, we ask that you avoid caffeine. You can do decaf products such as decaffeinated tea or decaffeinated coffee. The main issue with caffeine is it causes our stomach to overproduce gastric juices, or in other words, it increases the acidity of our stomach. And since our stomach will be a lot smaller after surgery, we want to do everything in our power to lower that acidity level so it's not bubbling up into our esophagus or other parts of our digestive tract. If we are having a higher load of acidity, that can cause ulcers as well. and lead to things such as heartburn and acid reflux. No using straws or gulping beverages after bariatric surgery. This kind of sounds like a strange one, but it's for good reason. We want to make sure that we're not pushing air into your stomach pouch after surgery for a couple reasons. If we're pushing air into your stomach pouch, it quite literally can fill you up on air. You'll feel full on air, which is a different full feeling than food would give you. It's more of a bloated, distended feeling, which can be very uncomfortable. And of course, we don't want to fill you up on air. We want to fill you up on protein and really important nutrients. Another thing is if we are filling you up on air by using straws or gulping beverages, that can actually lead to overwhelming the small intestine and cause vomiting. Next, we ask that you avoid beverages while eating and for 30 minutes after you are done eating. Another one that sounds kind of strange, but this is actually extremely important one. This is to make sure that we're preventing dumping syndrome. So as I mentioned earlier, high sugar and high fat foods and beverages can cause dumping syndrome, but this is also something that can cause dumping syndrome. So we want to make sure that when we are eating solids, we're not mixing it with liquids. I've kind of got a demonstration up here with a funnel. After surgery, your stomach is almost an extension of your esophagus. So you can think of it as a funnel, your new stomach as a funnel. If we put applesauce inside of this funnel, which we are supposed to be chewing our food to the consistency of applesauce, it will slowly drip through. And this goes to show your food going through the rest of your intestinal tract. So this would be going into your small intestine. So if it's just that solid food to the consistency of applesauce, it will slowly drip through this funnel or slowly drip through your stomach. If we add even a small amount of liquid to this, it starts to thin out that applesauce consistency, and then you will see the applesauce or your food flowing through at a faster rate. Especially if you're doing large amounts of water, if you imagined I would put a half a cup of water in this funnel with applesauce, it is going to run straight through. And that is kind of a way to show how your food would run straight through your body if we are doing the solids and fluids together. And it also is important that we're waiting that half an hour after eating to make sure that food is sitting in your stomach to get proper digestion before it does flow through to the rest of your intestines. Now, as your dietitian, my main priority is to make sure that you're getting those nutrients that you need. And it's not as simple as just physically eating those nutrients. We also want to make sure that you're absorbing them properly. So this is a very important part to make sure that absorption is happening. If things are flowing through you too fast, we are not giving your body the time to sit with those nutrients and pull them out in your small intestine. Next, we ask that you include multiple dairy sources into your daily intake. Dairy is the best protein source to promote healing and prevent bone loss. Of course, if you have a lactose sensitivity or intolerance, please do let your dietitian know at your next one-on-one meeting with them. And there are a ton of great lactose-free options that are still high in protein and have that calcium fortification. So that is it for the beverages part of this video. Please go on to the next and final video where we will be talking about lifestyle habits.